Anybody 6 months of age and older should get the flu vaccine because it's very important for them. And if we prevent them from getting influenza, we prevent them from probably getting secondary infections that occur after influenza. Some people do get secondary infections. In fact, some people wind up being hospitalized and going on a ventilator, and that's something that we want to see not happening. Last year, I think it was around 40%, 40 to 45% effective. We hope that we get a better effectivity for the flu shot. They make a guesstimate. This flu shot was developed last year, related to the flus that were circulating at that time, and then they do a guesstimate as to what they think the flu will be circulating. The flu vaccine that we use right now contains 4 different strains of flu. We have 2 flu A's and 2 flu B's, and that's extremely important. So we hope that with those 2, that we've hit a vaccine that's effective. Unless you've had a previous reaction, it's very, very rare that you get harm from the vaccine. The most that can happen to you is you get a little bit of flu-like symptoms, or your arm hurts you a little bit the next day, and that's about it. With the COVID pandemic, in March and April and May, the hospitals were totally overwhelmed with the amount of patients that were admitted. And these patients were on ventilators, and some of these patients were dying literally as they walked in the door. And we don't want to see that. If we do get this resurgence that they're expecting, we want to keep away as many people from the hospital that don't need to be in the hospital. So if you get a flu vaccine and the flu protects you from being admitted to the hospital, that will save our resources. At this point right now, we don't have a combined COVID and flu test that we could just use one swab. As far as I'm aware, we have to use 2 swabs. Whether you're doing a nasopharyngeal swab or an oral swab, you still need 2 swabs to send off because it's 2 different tests. Coronavirus is much, much more contagious, and it stays around for 10 to 14 days. You're infectious. With the flu and coronavirus, you're infectious before you show symptoms. So the day before you start your symptoms, you're infectious. But the flu, you're only infectious for up to 7 days. But coronavirus, you can be infectious from up to 10 to 14 days. So it's much more highly contagious. But it would be so important for people that are leaving the hospitals now, people going to their physician's offices, to get a pneumococcal vaccine, because we want to prevent you from getting pneumonia. Pneumonia vaccine is a bacterial pneumonia. COVID is a viral pneumonia. If we're going to have a virus, we don't want another bacteria going on board. That's something that we want to keep a patient safe. The best time to get a flu shot is right now. Don't wait. You can get it up until December, but the flu season has started. We don't know when exactly it's going to really overwhelm us, and we hope it won't overwhelm us. But as long as we keep masking and social distancing and washing our hands and cleaning the environment, we should be safe. I'm so frightened that people are being so relaxed with what we're doing right now because they're sick and tired of being quarantined, that now, since we had the summer and we went to the beach, now everything is going to be fine, and now the kids are going to go out to sports. The group ventures that people are having are a risk. They really are. There's another vaccine that we have, a flu vaccine, that's for ages 65 and older. This vaccine for the 65 and older has 4 times more of the ingredients that are in the normal flu vaccine. So if you're 65 or older, I totally recommend that you get the over 65 flu vaccine.